This is media briefing number 14 on the status of coronavirus in Mandera County. Today, the 14th of November 2020. Ladies and gentlemen of the press, welcome to our press briefing this afternoon, whose focus is on the county COVID-19 situation and a fresh call to action by each individual. As you may be aware, Kenya is experiencing the second wave of COVID-19 pandemic. In this second wave, which started in the month of October 2020, there is a great increase in the number of COVID-19 infections as well as fatalities, in which many lives have been lost, including health workers in the front lines. The main reason for this occurrence is as a result of the public letting down their guard due to pandemic fatigue. Here in Mandera County, we are now seeing a serious upsurge in numbers, with more people now showing serious symptoms of COVID-19 compared to before. While Mandera County government has done everything possible, including setting up isolation facilities with 306 beds, intensive care services at Mandera County Referral Hospital with up to 16 ICU bed capacity, between Mandera County Referral Hospital, Mandera Rehabilitation Center, and Elwak Sub-County Hospital. We've also set up we have also set up a testing laboratory at Mandera County Referral Hospital for virus test. Of particular is the COVID-19 molecular testing facility. We've commenced mass testing. It must be known that it's only through community involvement in observing preventive precautions that we can defeat this scourge. The last confirmed case of COVID-19 death was of someone who presented with symptoms of difficulty in breathing and was rushed to a private facility and passed on within minutes of arrival, and samples collected thereafter from the deceased has since turned positive. Across the learning institutions, only one case of confirmed COVID-19 was recorded at Duse Secondary School and in stable condition under home-based care. I will now give you the detailed breakdown of our situation in Mandera as it relates to COVID-19. The number of the new confirmed cases of COVID-19 in the last 24 hours in Mandera are 7, bringing the total number of cumulative confirmed cases in Mandera County to 80. You remember, the first phase, our infection topped 29 before the curve was flattened before this second wave. And second wave now, the number stands at 80 and rising. The total number of deaths reported since the outbreak are 4 in number. Case fatality rate is 5%. Home-based care, we have 37 patients. Facility-based care, these are patients requiring oxygen and other critical care, are 7 in our rehabilitation center COVID-19 response hospital. We've so far discharged from that facility 6, and the number of new deaths other than the first 2 are 2. The total number of samples tested since the beginning of outbreak is 1,172, of which 854 were tested at Nairobi lab, while 318 are tested at Mandera Molecular Lab. As of today, the number of confirmed cases of COVID-19 according to sub-counties are Mandera East 67, Mandera North 5, Mandera West 2, Mandera South 3, Banisa 2, Lafe 1, and Kutulo sub-county has not yet reported any case. All of the COVID-19 positive cases are Kenyans, all the 80. A total of 70 health workers were screened. These are frontline health workers dealing with COVID-19, of which one was positive, and this one who was positive was a medical officer on leave and likely contracted the disease from the community. He is now in stable condition and we wish him well. Screening at entry and exit points is ongoing at 18 sites in all the sub-counties. The total number of screened so far are 278,155, of which 194,321 were done at health facilities and 83,834 at entry and exit points. Enforcement of public health measures such as hand washing, social distancing, wearing of masks in public places is ongoing in all the sub-counties. A total of 88 schools were inspected for school COVID-19 compliance at all sub-counties, and the exercise is still ongoing. Ladies and gentlemen, from the foregoing, there is no doubt we are in a dangerous situation and we have no choice but to act fast to ensure every citizen takes it as a personal responsibility to comply with public health measures to cut off the transmission chain. Subsequently, the county government now directs as follows. All citizens must put on face mask anytime they step out of their homes, day or night. The county enforcement and security teams will apprehend and charge anybody who contravenes this directive. All sub-county and ward administrators are directed to work closely with health and security teams to make sure compliance is enforced to the letter. All service points in the county government and national government offices, as directed by His Excellency the President, must adopt a no mask, no service policy and also ensure the office space complies with COVID-19 transmission to minimize the risk of transmission, including checking temperatures of all persons coming to seek services from offices. Public service vehicles must comply with all the preventive measures, and where there is non-compliance, the permits will be automatically revoked. Leaders of mosques and churches must ensure that congregation wears masks. They must have a hand washing points. They must strictly observe social distancing. And for those of you who are going to the mosque leaders are advised to make sure that people come with their prayer mats to the mosque. The public is advised to visit health facilities when feeling sick or showing symptoms like coughing, fever, sneezing, and should not fear stigma associated with the disease. Corona illness is in most instances is short-lived, and in other circumstances it is lethal, but we must not relax in observing public health protocols at all times. Thank you very much.